I think the level of distrust of public health, of government, of vaccines, of the healthcare system that we have reached now would make any kind of disaster, whether it's a natural disaster or a man made virus or even a new novel pathogen. I think we're set up for disaster right now if we don't fix those issues of distrust, disinformation, things like that. Hello, everyone. I'm Dr. Tista Ghosh, physician, epidemiologist, award-winning health journalist, and author of Before the Next Crisis. And you are listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. From PHI Media, I'm Gordon Thane, and in this episode, Dr. Tista Ghosh joins us to unravel the real stories behind her new book, Before the Next Crisis, and what they reveal about the future of public health. Take a listen. So people might say, all right, Dr. Ghosh, the worst pandemic in almost 100 years or more than 100 years. We won't live through one again, or maybe it'll be 100 years out, and our generations won't need to worry or care about it. Much like climate change, it's like we won't see the devastating impacts. So why? Let's just live our lives. How close do you think the next crisis actually is? So you're saying before the next crisis, but when could that be?
I think it could be any time, and it doesn't have to be a global pandemic. I mean,
Okay.
part of what I do is work with health threats for my workers around the world. And what I've seen is last year, for example, the Brazilian hospital system almost collapsed because there were more mosquitoes as a result of climate change carrying various diseases into the country that they were ill equipped to deal with, into areas maybe that normally don't have those mosquitoes, or into areas that don't have those mosquitoes at that time of year. But as a result of illnesses like dengue, they were doing tent hospitals. It didn't hit the whole world, and it wasn't, but it was a major thing that impacted an entire country. And so we don't always hear about those things. But natural disasters, I mean, we're seeing more and more hurricanes, killer tornadoes, wildfires in Los Angeles in December, which is winter. Those are happening at greater and greater frequency. And floods in Spain that washed people away in their homes while they were sleeping. I think it doesn't have to be this giant virus that infects all of us at the same time, though I don't think that's out of the realm of possibility because of two things. One is bioweapons. I don't think we can rule out that, as we have wars sparking everywhere, that people aren't creating lab versions of various viruses. So as a national security or as a general international security issue, I don't think that's ruled out. And I think with more wars and political turmoil, that becomes a greater possibility, along with climate issues. And then as things change because of the climate, even if it's not a major disaster, there could be new novel viruses that, as they're interacting with different animal populations, mosquitoes coming into places that they didn't used to be. Even I've heard of viruses that are prehistoric melting, and they're still alive. They're still viable in the Arctic as things melt. So that humans have never been exposed to. So there's lots of possibilities. I don't think that it's going to be 100 years. Before the next crisis. May not be a global crisis. It could be, and it may not be the naturally occurring kind of pandemic that happens every 100 or so years. It could be a man-made one. So that's the reality. And I think the level of distrust of public health, of government, of vaccines, of the healthcare system that we have reached now would make any kind of disaster, whether it's a natural disaster or a man-made virus or even a new novel pathogen. I think we're set up for disaster right now if we don't fix those issues of distrust, disinformation, things like that.
And I think one of the articles you had shared about the nationwide survey in the US, the levels of trust, the decline was almost half of what it was, kind of or the latest set of results compared to what the recent survey showed. I think it was 71% down to 40%. That's astonishing. Like that change of in anything, whether it's even if it was something positive, would be widely remarkable. And when you think about the messaging, go talk to when we say talk to your trusted healthcare provider, we're making even a lot of assumptions, even making that recommendations that people inherently trust them in the first place. And so anyways, it starts to get into questions about where does that leave things, et cetera, et cetera. So as we're winding down to the end, I wanted to give you a bit of a thought experiment.
Okay.
So we've got your book, Before the Next Crisis. You reflect on a lot of things yourself, but you also bring in stories to show about how where people live can fundamentally make the experience look different, what they do for their jobs, how they live their lives. A lot of these factors contribute to how we might experience the crisis that we just experienced in very different ways. So if you were sort of armed with that book and with that level of knowledge, knowing what did happen, if you were to be able to go back in the past to January 2020 or September 2019 or December, whenever it was that you left your post at the your position as chief medical officer at Colorado State Public Health, how might you have approached things differently with the knowledge that you have now?
Yeah, I mean, of course, hindsight is 2020, so it's easier
No, I mean,
to say now.
You
Yeah,
would hope so, I guess.
yeah. But one of the things I would do is, first of all, fundamentally explain that science in real time thing. And people don't love uncertainty. And as experts, sometimes we feel like we have to be certain. But I think in that moment, we need to be honest about our uncertainty, and that every day we're learning something different and we're learning something new. And this was like throwing us onto a different planet that we'd never been on. And then asking somebody to be like, well, where should I go? We didn't have a map. So being upfront about where we are is we're on a new planet and we don't have a map. We're gonna make it, but we have to work together, and we have to understand that we're gonna make mistakes, and we're gonna go and get lost sometimes, but we will figure it out. And that kind of messaging early on would have been essential, rather than the hashtag not airborne kind of stuff, which later comes back to bite you. And then I think too, realizing that local context matters, using local data to guide. Okay,
Right.
we have to have X number of cases before we implement a lockdown.
Right.
In the meantime, what are other mitigation strategies that are less like psychologically harmful, that are less difficult and economically harmful, right? All those things. What are the lesser things we can do in the meantime in places where there aren't cases yet? And letting people know that the lockdowns are like the last resort. They're what we use when there's, our community is about to get overwhelmed. Our healthcare system is about to get overwhelmed. We will use this as a last resort. But in the meantime, here are the other things you can do, to kind of prepare or be limiting spread in our community. So using kind of our lesser tools in areas where they need it, and then preparing people for that lockdown might happen. Just might not happen at the same time in New York that it happens in rural Texas. And differentiating between urban and rural, being more nuanced in who we're dealing with and how we roll things out
Mm,
would be key.
mm. So would that happen if you don't have sort of a central person communicate? Because it's hard as a leader of a nation or something like
Yes.
that, or a public health official who speaks for the nation to communicate all those nuances in the 5 minutes they might have on the news.
Yes.
And so, like, delegating those decisions to cities, states to kind of work together to do what's best, while also collaborating with their neighbors, of course. But you'll have a little bit better
Absolutely.
contextual decision making if that happens, maybe.
Absolutely. And saying, maybe as the national person laying that out, saying, we've put out some criteria, we're suggesting use these tools, in these situations. When you get to sort of like almost like a red, yellow, green, when you get to yellow, use these tools. If you get to green, use these tools. And not just looking at how many cases are in the community, but the community itself. Is this a community that's more elderly? Is this a community that has more disadvantaged folks who may not have resources?
Right.
The, is this a community with a certain racial or ethnic background that's more prone to
Right.
diabetes or other risk factors, that
Occupational
asthma
hazards. Like,
or occupational hazards, right?
mm,
So being a little more, giving
mm,
more local authority to understand the community
mm.
and use it rather than using a blanket
Mm.
approach for entire nations. And again, it's easier to look back and say that
Right, of
I
course.
I don't have any blame for those who had to make these decisions at that time. I mean, it was, I can't imagine, yeah, what they were going through. So I'm not saying this in a negative or critical way, but really more of a constructive way that we can learn from and move forward
Before the next crisis.
before the next
Bef-
crisis. Yeah.
That's right. Any last words? So your book, Before the Next Crisis, I believe came out in August 2025. It's
Mhm.
available on Amazon and probably some other platforms as well. We'll include a link in the show notes. Any final words on the book and what people can look forward to by reading it?
Yeah, I really encourage everyone, and obviously I wrote it, so I'm going to encourage people to read it. But I do, because I think it's really critical right now that we understand where people were coming from and what's led to where we are now, because we're in a potentially dire situation with people not believing anything, and I think, or anyone, and looking at those different perspectives, it can help you uh, understand why they're where they are,
Hmm.
but that can also help you then message appropriately so that
Right,
you're
right,
not
right,
coming across as, well, I know everything.
right.
But I totally get where you're coming from. And I can see why you would think that. And here's why I would suggest you still do X, Y, and Z.
Hmm.
And why we can repair. I mean, we ended up recently with a shooting at CDC headquarters. We've ended up with one of the largest measles outbreak in the US in, I don't know, 50 or more years. We're seeing public health gains unraveling, and we're seeing violence, mental health issues, a lot of things arise that actually started during the pandemic. So we need to be able to see all the sides. And I mean, I know for me, writing this book was humbling because I was in my own ivory tower and didn't understand where people were coming from. So I think for people to really, especially people in public health and healthcare, to really be able to communicate best,
Mm-hmm.
they need to understand where people are coming from. And I think this book helps do that.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.